I've talked about this a lot on this show. I've talked about once we get the record in the hands of the patient, that we're going to see all sorts of new paradigms start to emerge, in that the patient's going to be able to decide to sell their data. It's not going to be something that a health system decides to do, or claims data gets sold and new industries get created. But there's going to be the ability for me, the patient, to go, I want to participate in this cancer study. I want to participate in this heart study, and potentially get compensated for it. Here's $5 for this, or $10 for that. So we'll create a sort of a data economy there. Plus, we'll create all sorts of new, really access changes. As I go from health system to health system, or I move from place to place, or I decide to use telehealth from a different provider, I'm going to be able to provide them my record instead of them having to request the record from another health system. I mean, do you let's start here. Do you think the patient should own the medical record? Do you think we should put it on every phone? You're a former security guy, so you know what that means. And then do you think that's going to enable more or different kinds of, ways of delivering health to that population? And is that going to really impact the health systems today?
So first of all, absolutely, patient owns data. And up until now, they just didn't have a way to access them. And other than, getting a printed copy of their medical record, or in some cases going to a web portal and trying to figure out what's happening. I mean, so the ways that we provide our patient data is inefficient and inadequate. And there are certainly not ways where a patient can easily say, hey, physician, this is my record from a hospital, this is my X-ray or lab results and so forth. So that's going to be very powerful. I think absolutely patient owns the data, and we need to make sure that the transfer of data from patient to whoever the patient is seeing, whether it's a hospital or a physician, is very easy, it's very quick, and it happens in a timely fashion. That is an absolute must. I think that what I'm concerned about is the lack of understanding with the security. So, we see in the news what's happening with Facebook and Google and GDPR, especially in Europe, and just the realization by people that their non-health data, their social media data, can be used in ways that nobody imagined, right? And can be mined in ways that nobody can ever imagine. Yep. And I think there's an educational component, first and foremost, to educate the patient that what can they expect once they share their data. Because Apple or Facebook, they are known to share the data with third parties. And I believe that Apple already have in their terms and conditions where they can share the data with third parties. So before a patient knows, the data is going to be not only with companies like Apple or Google, but all the ecosystem that they support. And I think first and foremost is an educational thing. The patient has to realize what they're sharing. And secondly, I think you will see some more rules and regulations around them. Probably it'll be a catch-up, like HIPAA was a catch-up. Yeah. But I think that will happen. That's a must. I'm not sure about the monetization piece, because for most companies, the benefit of the data is from scale, the millions of data sets that I think for foreseeable future is still larger organizations will manage. But that does not mean but I still believe that the given data to patient is very powerful. There may be organizations that are interested in a very niche studies. So you mentioned cancer. So if I'm an organization and my interest in lung cancer, I don't need hundreds of thousands, perhaps, and contacting a very special population and targeted population could probably help an independent researcher or a company who don't today have the means or have to spend a ton of money to gather that data. So again, what I think is liberation of data is going to be very powerful. There are going to be some issues to both technology, privacy, and security that we'll have to address. But I think we're at a point where if we don't address the barriers and the issues, I think the liberation of data will happen.